Hi, my name is Dr. Judy Wei, and I'm here at the Wei Aesthetic Institute. And I'd like to talk to you guys today about how we can get our abs to look much better. A lot of my patients are pregnant or recently delivered, and we notice a lot of changes during pregnancy to our abdominal wall, including the skin. So imagine carrying a 6 to 9 pound baby along with the amniotic fluid and all the tissue that needs to be built up during the pregnancy. How much does that stretch your abdominal wall? Your skin has to accommodate. Your skin grows during pregnancy, but a lot of the stretching still happens, which causes trauma and sometimes leads to things like stretch marks and thinning of your abdominal wall skin. And particularly, I think a lot of women that have gone through pregnancy will agree with me that their belly button used to be an innie and now becomes an outie. So the skin gets stretched, it gets thin, it can undergo a lot of different changes, but our tissue underneath also goes through a lot of changes. One of the tissue is your connective tissue, which is the fascia of our abdominal wall. So this is a very thick and robust connective tissue that's holding a lot of our structures within. So when our fascia gets stretched, traumatized, and weakened, sometimes it will leave a defect, not an actual hole, but the weakness of that area can then allow things underneath to pooch out. And that's called a hernia, where your fat tissue underneath that, or sometimes even your intestines, can pooch out through a defect in the fascia. Then your muscles can also be stretched out. And our main muscle in the center is our rectus abdominis. And what happens is this muscle is actually a group of two muscles, and it gets stretched very thin and very large, but also can separate. So some women, after they deliver, they have noticed that when they're sitting up from a lying down position, or when they're doing sit-ups or crunches, they start noticing like a little defect or pulling in right in the center, in the midline. And that's called a recti diastasis, where there's a separation of the muscles to the point where you can actually see it. So most women, you can feel a little groove right in the middle of your abdominal muscle, and that's normal because you have two muscles that are actually connected together. But when it's separated to a certain degree, you will see or feel that. And so that can be quite bothersome to some women. So all these structures, what can we do after you deliver? How can we get our body back to its original shape, or as close as you can? So there's different technologies out there that can assist in this process. There are definitely exercises that you can also do to strengthen your abdominal muscles and also the muscles on your flank to strengthen this core of your abdomen, so that it can help not only your abdominal wall in the front, but also can support your back, so you may have less back pain, back soreness, and back issues in general. So the technologies that are available nowadays are actually quite amazing, because they are changing every year, every decade. Things are coming out, and more focus has been placed on women's health. So it's actually really good for our patients, especially in the past several years, to find all these things that can be used to get us back to the condition that we were in before, or even better. So what can we do? So your skin, you do need some time to let it heal. There's time for it to kind of recover and go back to how it was. The younger you are, the more repair mechanism is available and more robust. And so even if you don't do too much, Someone that delivers at 18 years of age, their skin can bounce back very easily. But when you get to a certain age, or if your genetics of your connective tissue isn't the strongest, then that skin may have a harder time going back. And so you will see more laxity, more sagging, sometimes these folds that you don't necessarily, and sometimes these folds of skin that you don't really have much control, because exercise does not help with that. And what do you do is there are definitely treatments, and there's many different treatments, and we use treatment like this for our face and other parts of the body, which can be used on our abdomen too. So starting from some lasers, radio frequency treatments in the forms of profound or thermage are a very good treatment for skin tightening. Microneedling with your PRP, platelet-rich plasma, is a good option. Threads, you can also put smooth dissolvable threads into your abdomen, and that can strengthen and induce your collagen. And other things that are such as fractional lasers, skin resurfacing, other things that are out there that most people don't even know about. What about stretch marks? Stretch marks are breaks in the skin. Then your body has to heal somehow. So if you have a rapid increase in weight, such as in pregnancy, and sometimes not even during pregnancy, some people have huge fluctuations of weight, they gain a lot of weight, they lose their weight, and they start seeing these stretch marks. And so what happens is the skin just can't accommodate any more growth, and so there's literally these breaks in the skin. And what happens is your body fills this in with tissue that's not like your normal skin tissue. And so what can this be done? So what can we do about these issues is there's lasers, there's microneedling, there's a lot of combination therapies. The new plasma pen can also be quite useful. So lots of things that can be used to treat that. And the earlier you treat these, the fresher the stretch marks, the better the result. Stretch mark is not anything that you can completely erase. It's just very, very difficult because it's kind of like treating our scars, a very deep scar, but you can still get a really good overall increase in appearance where you don't see it very, very obviously. In certain lighting, you can see that it's much more not so visible, and that's what most people, at least, they want. So when it's fresh, it's red, it's purplish, that's when you treat it, you're gonna get a better result compared to if it's white, silvery, and those are older stretch marks, and you can still treat it. It's gonna be more resistant to very fast treatment, and so it's gonna take longer and more frequent treatment, and you may not see the best results. What about your muscles? What can you do with your muscles? You can work out, you can do sit-ups, you can do crunches, but what about muscles that have separated? So there is a technology called the M-Sculpt, which is also a technology that we talked about before, the Emsella chair that uses the same technology to strengthen our pelvic floor muscle, but this is strengthening your rectus muscles, so your ab muscles. So through the same electromagnetic focused energy, it's using that technology to really give you the super crunches so you can build that muscle. It can also decrease some of the fat above it, so you can get rid of your unwanted, fat, what we call the side effect of the M-Sculpt. And that can really give your muscle strength, but it can also bring the muscles together a little bit more. So we've seen people that have had the separation of the rectus muscles get closer in proximity, the two rectus muscles, but also people that have had back pain have noticed that their back pain has improved when they strengthen their rectus muscles. And when it comes to the fascia, you can't do too much with that unless you do surgery. And so if there's a very little separation, you may not see too much, but you can try to minimize its worsening. You can slow down its progress by not increasing your abdominal pressure too excessively. You can minimize your increase in your abdominal pressure, so avoiding constipation, avoiding lifting weights or carrying things, because these are all going to increase your abdominal pressure. So I hope this is helpful, and I just want to spread the word that there's a lot of treatment modalities that are available that most people don't even know about. And it's so nice to know that there's so many things that can help our patients get back to their original bodies, and sometimes even better. Not only for cosmetic or aesthetic purposes, but a lot of the times for functional purposes, and sometimes even mentally and a psychological, feeling good about what you see in the mirror day to day. So that's what I want to show you guys. And so if you have any further questions, please don't hesitate to contact